Here, I am ensuring that the patient is sitting down on the dental unit in an upright position and their jaw is parallel to the floor, while the height of the patient's mouth is parallel with my elbow. As I'm inserting this tray to check the fit on the patient, I'm ensuring the length, width, and height of the dental tray cover all areas that will be impressed, and the dental tray has around 4 to 5 millimeters of space for alginate printing material. Once I feel the impression has reached the correct consistency, I will place it on the upper dental tray, doing this mindfully, placing the alginate in important areas such as tooth abutment and rest preparation. Some alginate I've also made sure to be sufficient in the palate and rugae palatina area for these to be impressed as well. When I feel like the dental tray is perfectly fit in the patient's mouth, I move to the patient's back in order to have a more stable position while waiting for the alginate to set. Upon inspection and evaluation of the first results, I've decided to try again, this time performing the correct technique by stretching the patient's buccal fold as shown here in order to get an accurate impression of their vestibulum.
Perfect. I feel like she told me to put it inside. Ini aja. Begitu ya, Jill. I'm so sorry.
Here are the results of my upper impression. There are no porosities in the alginate. There's no part of the dental tray or the blue area that is visible. The edges of the impression looks rounded. The impression material is inseparable from the impression tray, and there's no saliva or blood that is seen. Here I would like to show the difference of doing the technique and how significant it is in creating the perfect impression of the vestibulum. Other landmarks that are present are the anatomy of the teeth, the palate with its rugae palatum, the residual ridge, and although we've created an impression of the labial and buccal frenulum, it is not seen in this angle. Before proceeding, I would like to explain the maintenance of the upper tray while I'm working on the lower impression. After I've rinsed with running water, I covered a wet tissue and put it in the important areas of the impression in order for it to keep its shape before we pour the gypsum material later on. Just like the upper impression, I place the alginate mindfully by placing it in important areas like the tooth abutment and the rest preparation.
Udah. Berantakan banget ya. Lagi nggak?
Here is the finished result of the lower arch impression. There are no porosities in the alginate. There is no part of the dental tray that is visible. However, some alginate impression is a little bit thinner in the posterior teeth. Impression material is inseparable from the dental tray and there's no saliva or blood. Other present landmarks are the vestibulum, the anatomy of the teeth itself, the residual ridge. The labial and buccal frenulum are not very clearly seen in this angle, and lastly the lingual frenulum. Since we do not have to wait for the lower arch before pouring, we only rinsed it with running water and pour it within 15 minutes.
How hard should you bite?
Kayak tadi udah bener, tapi I think you're gonna feel the difference if